Test, test, test. There he is. Okay, everybody cut your microphones, please, if you wouldn't mind. Should be over in the lower left. Mute your microphone, okay? If you wouldn't mind. Okay, if everybody can hear me, please say so on the right. I see David's can't comment, but thanks in advance. Okay. So everybody please comment. Yes, okay. Got one. Everybody that can, please comment over in the chat box. Okay, Mark can hear. That's good. Timothy, Yarka, Barco. Okay, got to open those 70-year-old ears, Yarka. Come on now. Got to hear better than that. Dr. Danforth, yes. Welcome. Some of you haven't been on this before. We hold these pretty much every Thursday that I possibly can. Try to have a different topic every time. Interference. And everybody else hear me clear? Yarka is having trouble hearing me. Breaking up. Well, I'm not quite sure what's doing that. Everything seems to be plugged in pretty good. On voice peaks, it gets scratchy. Okay, well, I apologize for that. I'm not really sure what's doing that. My computer's been acting up just a little bit the last couple of days. Okay, but one said it's been that way all along. Okay. All right. Well, let's jump into it. Welcome, everyone. Gonna have the chat box right over there. Okay, hopefully, and the point of doing these is that you're going to learn a lot of stuff that you didn't know. Of course, every time I do the research on them, I learn stuff I don't know either. So that's a good thing. When you're a teacher, you learn 2 or 3 times. Okay, hormone disruptors. Environmental chemicals have significant impacts on biological systems. Chemical exposures during early stages of development can disrupt normal patterns of development, thus dramatically alter disease susceptibility later in life. Endocrine disrupting chemicals, or EDCs, interfere with the body's endocrine system, produce adverse development. Let me see if I can put a red dot on there. Adverse developmental, reproductive, neurological, cardiovascular, metabolic, and immune effects in humans. A wide range of substances, both natural and man-made, are thought to cause endocrine disruption, including pharmaceuticals, dioxin-like compounds, polychlorinated biphenyls, DDT, other pesticides, and components of plastics such as bisphenol A or BPA, and phthalates. EDCs are found in many everyday products, including plastic bottles, metal food cans, detergents, flame retardants, food additives, toys, cosmetics, and pesticides. They interfere with synthesis, secretion, transport, activity or elimination of natural hormones. This interference can block or mimic hormone action, causing a wide range of effects on mechanisms and modes of action by which EDCs alter hormone signaling, and includes brief select disease endpoints associated with endocrine disruption. We're going to see a wide variety of those here, probably a lot more than you ever expected. I was certainly surprised when I really got into it. Potential EDCs are mostly man-made, found in various materials. By interfering with the body's endocrine system, endocrine disruptors produce adverse developmental, reproductive, neurological, and immune effects in humans, abnormal growth patterns, and neurodevelopmental delays in children. Thus, diethylstilbestrol, or DES, a non-steroidal estrogen, which is regarded as proof of concept, includes clear carcinoma among young women. EDCs may be found in plastic bottles, metal food cans, medical devices, detergent, flame retardants, toys, etc., and it lists the specific ones there, which it didn't before. They can be a real public health issue. A lot of things are unanswered, and a lot of investigations are just ongoing for a long period of time. The executive summary to the Endocrine Society's second scientific statement on environmental endocrine disrupting chemicals provides a synthesis of the key points. The full scientific statement represents a comprehensive review of the literature on 7 topics for which there is strong mechanistic, experimental, animal, and epidemiologic evidence for endocrine disruption, namely obesity and diabetes, female reproduction, male reproduction, hormone-sensitive cancers in females, prostate cancer, thyroid, neurodevelopmental, and neuroendocrine systems. Bisphenol A phthalates pesticides, persisting organic pollutants such as polychlorinated biphenyls, polybromated diethyl ethers, and dioxins were emphasized because these chemicals had the greatest depth and breadth of the available information. The statement also included thorough coverage of studies of developmental exposures to EDCs, especially in the fetus and infant, because these are critical life stages during which perturbations of hormones can increase the probability of a disease or dysfunction later in life. A much fuller understanding of the endocrine principles by which EDCs act include non-monotonic dose responses, low dose effects, and developmental vulnerability. These findings will prove useful in translating the science of endocrine disruption to improve public health. And it has epidemiological, animal, and cellular data link. There's disproportionate exposure to diabetes-associated EDCs may be an underappreciated contributor to disparities in metabolic disease risk. The burdens of diabetes is not uniformly borne by American society. This disease disproportionately affects certain populations, including Native Americans, African Americans, Latinos, low-income individuals. Surprisingly, Native Americans was not included in that. I put that there. They have maybe 35% of their population that are included. So I couldn't understand why they didn't include that in there. So I threw it in there. Okay. Purpose of this study was to review the evidence linking unequal exposure to EDCs with racial, ethnic, and socioeconomic diabetes disparities in the U.S., discuss social forces promoting these disparities, explore potential interventions, articles examining the links between chemical exposures, metabolic disease were extracted from the U.S. National Library of Medicine from 1966 to 2016. Numerous studies have reported significantly high exposures to diabetogenic EDCs, including polychlorinated biphenyls, organochlorine pesticides, multiple chemical constituents of air pollution, bisphenol A, and phthalates. By the way, COVID is being linked to heavy air pollution areas too, if you didn't see the recent stuff on that. but I diverge a little bit there. This review reveals that unequal exposure to EDCs may be a novel contributor to diabetes disparities. The purpose of this study was to review all the stuff linked to diabetes with impaired glucose metabolism. It's graded according to the Grading of Recommendations Assessment, Development, Evaluation, or GRADE classification. Over 40 cross-sectional and 7 prospective studies were utilized. The evidence is scarce since very few prospective studies exist. Endocrine disrupting chemicals affect not only steroid hormones but various signaling molecules, including any ligand-mediated signal transduction pathways. DDT, a pesticide, is already banned. Now, it's banned in the United States, but it's not banned in basically the rest of the world, and the United States imports crops that are sprayed with DDT. Go figure. They haven't blocked the import of them. Okay? Recently, an industrial raw material, bisphenol A, has attracted worldwide attention. And all of us have heard about that. BPA derivatives is investigated to introduce novel perspective on BPA derivatives, especially recently developed BPA derivative bisphenol C, which you may not have heard of. It's structurally similar to DDT derivative called DDE. If you can pronounce that, good luck to you there. There is increasing experimental and epidemiological evidence that fetal programming of genetic systems is a contributing factor in the recent increase in adult obesity, other components of the metabolic syndrome. In particular, there is evidence that epigenetic changes associated with the use of man-made chemicals may interact with other factors that influence fetal and postnatal growth. Okay, epigenetics basically comes phenotypically. Okay, so you have genotype, what's programmed to happen, and phenotype, which is above and outside the genetics, which we're going to get into that here. Okay, focus on the developmental effects of estrogenic endocrine disrupting chemicals, specific line effects of exposure to EDC bisphenol A in adipocytes and their function. Somebody has your microphone on. Please click in the lower left, the mute button, if you would, please. We can hear you. Cause impaired reproductive capacity from adult obesity. Interaction of EDCs and other factors during fetal neonatal life, such as placental blood flow and nutrient transport to fetuses, and how these influence fetal growth and abnormalities in homeostatic control systems required to maintain normal body weight throughout life. Many chemicals in the environment, especially those with estrogenic activity. Okay, somebody has their microphone on. Please mute yourself. We can hear you. Please mute yourself. It's in the lower left hand. They're able to disrupt the programming of endocrine signaling pathways established during development. These chemicals are referred to as endocrine disrupting chemicals. Altered programming can result in numerous adverse consequences in estrogen target tissue, some of which may not be apparent until later in life. They have reproductive changes, obesity, diabetes. You have environmental estrogens and other endocrine disrupting chemicals. For example, a murine model of perinatal exposure to diethylstilbestrol. It's estrogen target tissues. Abnormal programming by estrogenic chemicals provide the evidence of supporting scientific concept termed the developmental origins of adult disease. Furthermore, the association of environmental estrogens with obesity and diabetes expands the focus on these diseases from intervention or treatment to include prevention or avoidance of chemical modifiers, especially during critical windows of development. Now you have xenobiotic, or chemicals to which an organism is exposed that are extrinsic to the normal metabolism of that organism, and dietary compounds with hormone-like activity can disrupt endocrine signaling pathways, play important roles during perinatal differentiation, result in alterations that are not apparent until later life. So you have exposure to environmental hormone mimics that are associated with diabetes, but now cardiovascular disease. See, we're expanding on the number of conditions here. Animal models, estrogenic activity, programming organic obesity. An animal model provides for the growing scientific field termed the developmental origins of adult disease. Now, you're going to see a lot of different things like this you're probably not familiar with in this presentation. Suggest new targets of abnormal programming by endocrine disrupting chemicals. So we have environmental estrogens associated with obesity and diabetes. Then you have differentiating estrogen target tissues, including phytoestrogen, genistein, bisphenol A, and suggest new targets, adipocyte differentiation, molecular mechanisms involved in weight homeostasis. So basically you're getting weight off ground here, and we're going to see several mechanisms for that. They're programmed by estrogenic chemicals. Now this expands the focus on the diseases from intervention and treatment to include prevention and avoidance of chemical modifiers during critical windows. They can interfere with any aspect of endogenous hormones. The observed upsurge of metabolic disease cannot be fully attributed to increased caloric intake, physical inactivity, sleep deficit, and aging, so that's why they started looking at this. EDCs have drawn the biggest attention of the scientific community, and not unjustifiably. You include crucial metabolically active organs such as the hypothalamus, the adipose tissue, pancreatic beta cells, skeletal muscle, and liver. Now those of you that are in subluxation only and things that cause subluxation, you're trying to justify intervening nutritionally and evaluating these things. Here it is right here. Skeletal muscle right there. Okay, there's your justification for putting that in your practice if you're in one of those states. We also have the liver here. So look, we're getting several different organs of the body, and including the brain, and we're going to see several different areas of the brain that are impacted here as well. They can promote the disruption of individual or multiple systems involved in the metabolism. There are epigenetic changes that can permanently alter the epigenome in the germline. Now, I always hate to say permanently, but that's what they said, because I think you can alter that. If you look at Pottinger's cats, something can lead to something and you can back it off over a period of generations also. So I kind of doubt that permanently over generations. This enables changes to be transmitted to subsequent generations, and it's a multifaceted attack in the manifestation of metabolic disease. So you have obesity, metabolic syndrome, diabetes mellitus, non-alcoholic fatty liver disease is one of the things with the liver. EDCs constitute a crucial parameter of the global deterioration of metabolic health we currently encounter. Endocrine disrupting chemicals are defined as exogenous chemicals or mixtures of chemicals that can interfere with any aspect of hormone action. Adipose tissue is a true endocrine organ. So now they're saying adipose tissue itself is a true endocrine organ. Subset of EDCs called Obesogens, which is a new term you may not have heard. How many of you have heard of Obesogens before? Let's put yes or no in the comments box over here. How many of you have heard of Obesogens? Mark says no. No. Nope. Okay, so we're adding to our repertoire here. Yes, but I never heard it called that, right? Well, you've heard the term. So now, the interesting thing about this, when you're talking with other scientists, you can use these terms and come off as knowing a whole lot more than the general doctor does, okay? These interfere with neuroendocrine control of appetite and satiety. So, neuroendocrine control of appetite and satiety. Now we're talking about all the obesity programs here. Obesogen exposure can alter the epigenome of multipotent stromal stem cells, biasing them toward the adipocyte lineage at the expense of bone. So when people are getting injections of stem cells, if they have these particular chemicals in there, they can cause them not to do what you injected them to do. Okay? They can actually, cause a problem with that. They bias them toward an adipocyte lineage at the expense of bone. So you stick some of that in the bone marrow, it turns into fat in the marrow, for example. And you have people that have a lifelong struggle to maintain a healthy weight promoted by these adipocytes. Obesogens are chemicals that directly or indirectly lead to increased fat accumulation and obesity. And they have the potential to disrupt multiple metabolic signaling pathways in the developmental organism. You have Butyltin activates peroxisome proliferator activated receptor gamma and stimulated adipogenesis. So we have like 3 or 4 different mechanisms now for this. Okay. And you have peroxisome proliferator activated receptor gamma, the master regulator of adipogenesis. Others act through as yet unidentified pathways. Noticeably, some of the obesogens elicit transgenerational effects on a variety of health endpoints, including obesity in offspring after exposure of pregnant FO females. Do you know what an FO female is? Let's see the answer over here. What is an FO female? Does anybody know what an FO female is? See some interaction here. I'm going to show you how to read these terms when you're looking at stuff like this. Anybody know what an FO female is? Come on, we only have one person that's answered. Let's get in here and answer this. FO female. Original generation, very good. Okay. So if you see 1, it's the first generation offspring. If you see F2, it's the second generation offspring. If you see F3, it's the third generation offspring. So there you go. Okay, very good. So they're exposed to xenobiotic compounds. However, this explanation does not account for numerous recent research findings demonstrating that a variety of environmental factors can be superimposed on a diet and exercise to influence the development of obesity. Obesity is considered a 20th century pandemic. Oh my God! They're going to shut down the whole world now, or at least the United States, because we're in an obesity pandemic. Are we going to get $2,000 a month while everybody's fat? I think we should. What do you all think? Let's see that in the chat box over here. We're in a pandemic of obesity. That's long before this present one. Yeah, we have sure. Let's do that, right? Great comment. Yeah, okay. Well, where these pandemic ends, don't you think that obesity causes a lot more deaths than COVID does? Right? Obesity causes a lot more deaths, so hey, we ought to drop everything until we defeat this pandemic, right? There you go. Okay. It's often a worldwide, but especially in the United States from Obesogens. Okay. Then we have a whole dissertation here on Obesogens. Now you have a microbial dysbiosis in the gut. Okay. And that's the endocrine disruptors are in there. So it's an induction of xenobiotic pathways, associated genes, enzymes, and metabolites involved in EDC metabolism. So now we are getting into the gut. Okay, this EDCs can be taken up by the host, can have a major impact on host metabolism and the development of the diseases. They interact with gut microbiota through different pathways. We had 2 people drop off this. They're getting out of the most interesting stuff, I think, here. Okay, they result in long term in the development of certain pathophysiological conditions. Now, steroid hormones are developed in the gut. You have what's called an endobolome for the microbiota. How many of you have heard of the endobolome, the gut biome? Endobolome. How many of you have heard of that? Let's see that in the chat box. Endobolome. No, not that term. Right, we just heard of microbiome, right? Okay, now we're learning new terms here today. Xenobiotics that alter the gut microbial composition. Microbiota disrupting chemicals. How many of you heard of microbiota disrupting chemicals? Let's see that in the chat box. Microbiota disrupting chemicals. Nope. Yes? 1 did. 2 did. Good. Very good. 3 did. Very good. Okay, so we hear about these things causing problems in the human, but how many of us really heard about these chemicals changing that? Yeah, we have antibiotics, but that really isn't in this discussion. And I get that, Doc, since you put that in there. Okay, these modifiers, those contained or released from the diet, environment, physical activity, and stress. Okay, so the contaminants from other microbiota, natural modifiers. So stress can do it. Physical activity can do it. The environment, like the pollution, the diet, promotes specific changes in the microbiota, result in common intestinal and chronic or long-term systemic diseases in the host. So now we're talking about these particular things working just in the gut biome, causing long-term systemic diseases in the host. Gut microbiotic changes. But this is according to host susceptibility. Remember, whenever I talk, any of you who've taken my part 4, I always talk about not everybody is susceptible, but you have to consider whether that person in front of you is a certain susceptible person relative to something, okay? So they even note that right here in the gut microbiota. So when you're counseling somebody, you got to see, well, are they overactive or underactive physically? What is their stress that they're under? Okay. What is the... Okay, somebody is talking in the background. Please mute yourself. Everybody can hear you. Please mute yourself. Okay, are they in an environment where there's a lot of pollutants, either indoors or outdoors? Okay. What is in their diet? You know, canned or boxed foods or frozen foods that may have things like this. Okay. MDC, Microbiota Host Health Axis. How many of you heard of that term? Epidemiological studies. MDC, Microbiota Host Health Axis. How many of you heard of that one? Let's see a little interaction over here in the chat box. No. 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 Okay, so we're learning some more new terms here. The gut biome consists of over 10 to the third to 10 to the fourth microorganism inhabitants. Together they possess 150 times more genes than the human genome, and thus should be considered an organ in and of itself. So our gut biome should be considered an organ in itself. How many of you knew that? Let's see that in there. Not just an interaction of organisms, but should be considered an organ in and of itself. One yes, one no. Let's see interaction over here. Yes. Okay, good. A couple of you heard of that. Such communities of bacteria are in dynamic flux and susceptible to changes in host environment and body condition. In turn, gut biome disturbances can affect health status of the host. Gut dysbiosis might result in obesity, diabetes, gastrointestinal, immunological, and neurobehavioral disorders. That's the gut brain, which we'll see more of. Favoring more pathogenic species that produce various virulence factors such as lipopolysaccharides. Bacterial virulence factors and metabolites may be transmitted to distal target sites, including the brain. So you have the gut-brain axis here, okay? Other potential mechanisms by which gut dysbiosis can affect the host include bacterial-produced metabolites, production of hormones, factors that mimic those produced by the host, and epimutations. Endocrine disrupting chemicals, or EDCs, heavy metals, air pollution, and nanoparticles can influence the gut biome. Potential environmental chemical-induced gut microbiome changes might subsequently induce pathophysiological changes in the host. So, instead of just giving people probiotics and prebiotics to induce postbiotics, somebody said, Richard, please mute your mic. They can tell who's doing that. I can't tell from my side. So Richard, please mute your mic. Thank you. You should be asking them about these different things, okay? Although definitive evidence for such effects is lasting, by understanding how these chemicals result in gut dysbiosis may open up new remediation strategies in animals, including humans exposed to such chemicals. Xenoestrogens are chemicals found in plant products such as genistein, in industrial chemicals like bisphenol A, plastics, other products that are present in the environment. Early exposure may affect brain development by directly disrupting neural programming and or through microbiome gut-brain axis. So you have a fecal metabolome. How many of you have heard the term fetal metabolome? Fetal metabolome. Let's see in the chat box over here. How many of you have heard fetal metabolome? No, no, no. Good. We're learning a few things here. Okay. The LD but not UD of BPA exposure resulted in individuals spending more time engaging in repetitive behaviors. So here you have repetitive behaviors. And they have socio-communicative disturbances. What could be a repetitive behavior and socio-communicative disturbance? Let's see in the chat box some suggestions of some of those. About autism, those are autistic characteristics, okay? Today's civil unrest, yeah, that could be one, yep. Of course, you can get rid of some of that. OCD, yeah, obsessive compulsive disorder. All right. They show alterations in lysine degradation and phenylalanine and tyrosine metabolism. So here we're getting into some very specific amino acid changes. They might affect the microbiome gut-brain axis. Bisphenol A. Adverse effects: impaired brain development, sexual differentiation, behavior, immune function, which could extend to future generations. Changes in DNA methylation status and altered expression of specific genes in offspring, and these are phenotypic outcomes and epigenetic effects. BPA exposure effects: sexual differentiation and behavior may disrupt epigenetic programming of gene expression in the brain. Brain region-specific changes of genes encoding estrogen receptors, estrogen-related receptor in juvenile offspring, epigenetic regulators DNA methyltransferase, and juvenile cortex and hypothalamus. So cortex and hypothalamus. Cortex in the males, hypothalamus in the females. We're associated with DNA methylation changes. So here we have problems with DNA methylation, which of course can relate, the DNA and the RNA, and specifically folic acid and vitamin B12 methylation, as well as possibly a few other B vitamins that affect that. Sex-specific effects on social and anxiety-like behavior, leading to disruption of sexually dimorphic behaviors. Caused by epigenetic disruption of the brain function, behavior, especially regarding sexually dimorphic phenotypes. They alter sex-specific neural organization, neuroendocrine physiology, and behavior. And in the rat brain, estrogen is masculinizing. Later in life, neuroendocrine affects postnatal limbic nuclei, metabasal hypothalamus, and amygdala. Here we're getting a lot of different areas of the brain, highlighting the potential for gavage to influence gene expression in the developing brain. Endocrine disrupting chemicals are added to food, cosmetic, plastic packages, and children's toys. Here we have a number of them here. Development, function, lifespan of immune cells such as monocytes, neutrophils, mast cells, eosinophils, lymphocyte, dendritic cells, natural killers. So you can see how you can look at some of these things and see how they could alter your blood tests of your patients, basically here. Okay, and there are dose-dependent effects and low-dose effects. You have immunity-related diseases such as allergy, asthma, diabetes, and lupus. Okay, so here we have a lot of different conditions. Immune metabolic alterations, inflammation, and oxidative stress. Okay, hepatic maladaptive processes associated with the high-fat diet induced obesity in mice. And you have lipid metabolism in serum and or liver were examined. Liver damage progression and inflammatory immune response were determined by histological and molecular analysis. Hepatic immunometabolic dysfunction. You have inflammasome. How many of you have heard the term inflammasome before? Let's see over in the chat box. How many of you have heard inflammasome? No? No? Yes? Good. One yes in there. Okay. Inflammatory cytokine transcription and promoting fibrosis progression. So now we're promoting fibrosis in the body. Okay. This study represents the BPA exposure. Goes with fatty liver disease. You have a crosstalk between oxidative stress and immune metabolic impairment due to obesity. Now we got a crosstalk here, okay? Now you have type 2 diabetes and obesity, and you have chemicals like bisphenol A and phthalates. Now, this has detrimental effects on metabolic health, the immune system, immunomodulatory roles of EDCs, non-alcoholic fatty liver disease, NAFLD, a growing epidemic of non-alcoholic fatty liver disease, obesity and diabetes mellitus, cirrhosis, now we got another condition, hepatocellular carcinoma, another condition, hepatic steatosis, or fatty liver, nuclear hormone receptor function, and the alteration of the epigenome. Hepatic cellular carcinoma, hepatic stellate cells senescence has been suggested to bridge tissue aging with alterations of the intestinal microbiota. Okay, so now we have hepatic disease related to the change in the intestinal microbiota. Atrazine, which is commonly used herbicide, decreased in liver weight, changes in liver and testes gene expression, specifically genes involved in lipid uptake, fatty acid metabolism in the liver, as well as androgen conversion in the testes. So now we can cause maybe sterility. It's banned in the European Union. It's known to alter testosterone and estrogen production and thus reproductive characteristics. Now, what else can you give? Beginning in utero, shortening or demasculization of the penis structures. Ouch, I just felt that. Increases the incidence of hypospadias in mice, or short penis. Now you have, here we apply the 9 so-called Hill criteria. Strength, consistency, specificity, temporality, biological gradient, plausibility, coherence, experiment, and analogy. Now you have an endocrine disruptor that demasculinizes and feminizes the gonads of the male vertebrates. Atrazine demasculinizes male gonads, producing testicular lesions associated with reduced germ cell numbers and partial or complete feminization. You have EDCs such as plasticizers and pesticides, dioxins, polycyclic aromatic hydrocarbons, causing transgenerational epigenetic effects, testicular prostate abnormalities, metabolic disorders, behavioral anomalies. So all the depression, anxiety, all of that, a lot of that may be coming out of all this also that we're seeing, especially in our society today. Tumor development, epigenetic mechanism, changes in DNA methylation patterns, transcriptome, expression of DNA methyltransferases. Now, bisphenol A, phthalates, and parabens now. Parabens are in a number of things, such as cosmetics, for example. And parabens are in medications. DNA methylation, histone, post-translational modifications, and non-coding RNAs. So now we're having trouble with RNAs. So that would cause problems then with DNAs too. Transgenerational inheritance of reproductive, metabolic, or neurological phenotypes. Cancers and diabetes. All transgenerational. Fetal origins of adult disease. In utero neonatal exposure to bisphenol A associated with higher body weight. So we're starting, being fat right there. Increased breast and prostate cancer and altered reproductive function. DNA methylation, histone, small regulatory RNAs. The epigenome systematically controls gene expression during development, both in utero and throughout life. Bisphenol and EDC is used in production of plastics and rosins, both, so it's in a lot of stuff. Diethylstilbestrol and BPA cause changes in the developing uterus, breast cancer in adult women. They're associated with cancer pathways. Now, something different, multiple collagen genes. So the BPA-exposed fibroblasts result in increased collagen deposition in the adult mammary gland, cause a less permeable extracellular matrix, and stiffer mammary gland. Okay. Epigenome undergoes significant remodeling during tissue and or organ development. Can reprogram the epigenome, developing tissues to increase susceptibility to diseases in later life or developmental reprogramming. Altered methyl donor availability, loss of imprinting control, changes in deoxygenase activity, altered expression of non-coding RNAs, activation of cell signaling pathways that can phosphorylate and alter the activity of histone methyltransferases. In some cases, alter gene expression in ways that correlate with increased disease susceptibility just in general. Transmission of phenotypes across multiple generations via the germline. You have acquired epigenetic marks, particularly DNA methylation, inherited following parental EDC exposure. Can escape embryonic epigenome reprogramming. You have DNA methylation across multiple generations, can vary among individuals. Here again, are you a certain susceptible person? You always have to gauge that. EDCs are associated with dysfunction of metabolism, energy balance. Now we have all this chronic fatigue syndrome going around. Thyroid function. Now we got a different gland here. Reproduction, increased risk of endocrine cancers in general. Programmed through molecular epigenetic changes. May not manifest till adulthood. So you're really healthy and all of a sudden, boom, you got something out of nowhere. May be passed to future generations by non-genomic inheritance. Here, not even using the genome here, okay? And here's several EDCs that do that. Now, it can affect the function of the reproductive system depending on steroid hormones, estrogenic and anti-androgenic endocrine disrupting chemicals, reproductive dysfunction in adulthood, ovarian reserve, female cycling, adult uterine abnormalities, sperm quality, prostate disease, and mating behavior. And right now there are a lot less people around the world, let alone the United States, that are just not having as many babies. They just aren't as interested sexually in each other. And that's been going on and getting worse and worse, such that a lot of the populations in several countries are having negative population growth. In other words, they're dropping populations. So they basically rely on influx from countries that have excess population. And here are several EDCs that do that. They include direct mimicry of sex steroids or morphogens and interference with epigenetic and sculpting during cell and tissue differentiation. You have underlying developmental plasticity. You have epimutations, transgenerational, and epimutagenesis. Now the PCBs and the fungicide vinoclozaline perturb hormone signaling. So now we have hormone signaling issues that can affect the phenotypes. Anxiety and social behaviors. Here we get into the depressions and etc. Now we're affecting the hippocampus and the central amygdala. Look at all these areas of the brain that are being affected, let alone all the other organ systems. Now, it affects the serum progesterone and estradiol. So if you have somebody come in your office and these are off, and you look at them and you're going, well, there's no good reason for this, they probably have a lot of these substances in them that are causing that. Reproductive and adrenal organ weights, birth outcomes, sex ratio, estrous cycles were unaffected. So here are some that they found were unaffected. Now, PBCs caused body weight and hormonal effects, and this is in rats. Were not observed in the F1, so your children, but the grandchildren and great-grandchildren were affected. Further, most were in the maternal lineage, so going through the mother each time. Hear about a lot of stuff going through fathers like baldness, but this goes through the mother. Reproductive toxicology. We have endocrine disrupting chemicals generally function as steroid receptor signaling antagonists or agonists. So they hype the signal or they block the signal. So you have adult onset disease states, male infertility, increased frequencies of tumors, prostate disease, kidney diseases, immune abnormalities that develop as male age. Here we're getting into kidneys now, okay? And promote transgenerational phenotypes. The majority of environmental factors such as nutrition or toxicants such as endocrine disruptors do not promote genetic mutation or alterations in the DNA sequence. However, these do have the capacity to alter the epigenome or epimutations outside of the genome. And then you have the pesticide mixture, which includes DEET. Promotes epigenetic transgenerational disease. And that's a pesticide and insect repellent that's used in most people's homes, okay? Atrazine, used on corn and soy crops most commonly. Can cause lean phenotype or testes disease. Glyphosate, which we've all heard a lot of. Epigenetic transgenerational inheritance of pathology and disease in subsequent great-grand offspring, or F3 generation. In the Epigenome-Wide Association Study, or EWAS. So they did a long-term study on that. You have the FO generation, the F1 generation. The FO generation didn't develop obesity, but the F1, kidney disease, prostate disease, ovary disease, tumor development as adults. So your children develop it because of your exposure. Metabolic syndrome, obesity were observed testes, ovary, and kidney. Poorest population had higher exposure and less favorable outcomes. Eating a lot more junk food, I take it. You have the DEET pesticide combination. Promoted transgenerational testis disease, prostate, kidney, multiple disease, and the F3 or great-great-grand offspring. You have epigenetic biomarkers, prostate, kidney disease, obesity, multiple diseases, chromosomal locations. Vinclozolin, exposure during gonadal sex determination promotes a transgenerational increase in pregnancy abnormalities and female adult onset disease states, anti-androgenic activity in vinclozolin, which is a pesticide. Here you have litter effects from it. For the past 120 years, the Weissman barrier and associated germplasm theory of heredity It's impacted evolutionary biology, inheritance of phenotypic variation and pathology. So that's what they've been using. Present study talks about postnatal development of adrenal zona fasciculata in rats exposed to low doses of endocrine disruptor. This particular one, prenatally and postnatally. Breast cancer, second most common cancer and fifth deadliest in the world. It's exposure to endocrine disrupting pollutants. Endometriosis, here's another condition. Several studies on that one. Cryptorchidism, hypospadias, low sperm count, testicular cancer. So now we have cryptorchidism. Male reproductive orders, smaller risk. Now we have couple fecundability is measured by time to pregnancy, which is TTP. There's a lot on that. Now we have the longitudinal investigation of fertility and environment, or the life study. So we have a lot of comments on that particular study here. Chemical classes, metals, persistent organic pollutants, environmental phenols, and phthalates. Breast growth dissipated in all patients with discontinuation of fragrance products. Okay, so you have an estrogenic action causing breast growth in prepubertal girls and a boy. Okay, so the fragrances were causing breast growth where there shouldn't have been any. Okay, how many of you knew about that? Fragrance products are causing prepubertal, so the younger girls are getting breasts now. A lot of boys are getting breasts because of colognes and all these fragrances that we're into. Let's see over here in the chat box how many of you knew that. Fragrances are causing all sorts of breast growth issues. We have two no's, we have a yes, we have a no, yep, no, yes, no, yes, yes. Good. Some people knew that. Cases of premature thelarchy, the stages of which male and female breasts become distinct due to variance in hormone levels. However, some males have a condition in which they develop breasts called gynecomastia. Thelarchy is also known as breast budding. Typically occurs between 8 and 13 years with significant variations between individuals, resolved upon cessation of lavender containing fragrance and exposure. Lavender oil, which is a big thing right now, is causing premature breasts. How many of you knew that? Lavender oil. Dr. Warman, yes. Mark, no, no, no. Yeah, lavender is a big thing for people just trying to, hey, put themselves to sleep and feel calm and all that sort of thing. So start asking your patients that are having breast issues, like, I've had several young men come in and they were having lumps, in their breast tissue growing up. And I started asking, okay, how many fragrances are you around? And just the spray in the bathroom harbors it. Candles have it. Look at all the things that have fragrances in them. And a lot of them are lavender. Okay? A lot of them are lavender. So you know something to ask people there. But guess what? Pathological sources of testosterone and estrogen production. Lavender and tea tree oil. Tea tree oil. Is it pure lavender or mixed chemical with lavender? It could be either one of them. Okay? How many of you knew tea tree oil could be an endocrine disruptor? Some of you knew about lavender, but what about tea tree oil? That's being used by a whole lot of people in a whole lot of herbs. Okay? So now you know two different herbals to be really concerned about. Dr. Warman, yes. Yeah, one of you sent me an email. Oh, did you know about lavender and tea tree oil right before the class? I said, yeah, it's on there. Thank you for asking me, though. Now, this is in a cologne named Agua de Violatas in Hispanic communities, where they found that was causing problems. Data were from the Center for Health Assessment of Mothers and Children of Salinas, which is right here. A longitudinal cohort study followed 338 children. Okay, in girls, we observed earlier onset of pubic hair development with prenatal urinary MEP concentrations. Regarding peripubertal biomarkers, earlier breast development, pubic hair development, and menarche, so early onset menses, with methylparaben. So here's the paraben in medications and in cosmetics causing all of this, okay? How many of you knew about that? Let's see that over there in the comments. Medications and cosmetics causing these things. A couple of you knew about, a couple of you didn't. So you got to start asking the young girls who are coming in with all sorts of problems, how much makeup are you using? Hey, this can be causing your problems right now. Hair dye. How many of you knew hair dye was causing problems? Hair dye. No, yes, yes. Okay. Those used it sometimes were 9% more likely. However, among African American women using permanent dyes every 5 to 8 weeks or more associated with a 60% increased risk of breast cancer. How many of you knew that? 60% increased risk. 60% increased risk. That is a lot. As compared with an 8% risk for white women. So the blacks are a lot more susceptible. Talc is used in powders, eyeshadows, blush, other cosmetics. We're just thinking of like baby powder for talc. Eyeshadows, blush, other cosmetics to absorb moisture to prevent caking, to make facial makeup opaque, or to improve the feel of the product. How many of you knew talc was used in all that and not just the baby powder? How many of you knew that? Couple? Oh, several of you. That's good. That's good. Okay, the U.S. Food and Drug Administration hosted a public meeting. Yeah, EMPs can cause cancers and a variety of non-cancer effects. Asbestiform. Now you have serpentine, amphiboly, silicate minerals, okay? Asbestos. Okay, EMPs are elongate mineral particles. That's what's in talc. How many of you knew that the asbestos was the problem with talc? How many of you knew that? Let's see that over here. Asbestos is the problem with talc. Not a whole lot on that. Oh, one did. Very good. Very good. Let's see. Serpentine. So you may see some of these in makeups. So we're listing them here for you. Ten key characteristics of EDCs. Right here. We listed them out for you. Somebody's making a lot of noise out there. Please block your microphone. You're rustling paper or something. Okay? Now, here we provided a diagram. Okay? Here's where all this goes. Right here. Okay? All that's available to you. You can have a copy of this. All you got to do is either send me an email or click the box asking for it on your Zoom. And my email is drBBRK@hotmail.com. And you can call me 469-995-9907. Also, for anything. Okay, does anybody, before we leave this and go on to best practices, stuff like that, does anybody have a question over any of this? We went just a little bit over the hour, and I apologize for that. Okay, Dr. Warman's mic is unmuted. Dr. Warman, please mute yourself. Okay, anybody have any questions over any of this? You're all welcome to this presentation. Anything on it? Is this leading to transgender issues? Yes. Dr. Danforth, great, thank you. Yes, it absolutely is. All of those things can be coming out of these to some degree at least. Okay, after review, yeah, this is evil. Absolutely it is. And as I was going through this, I was getting a better appreciation for California blocking a lot of this stuff, and some of the other countries that do also. So, you know, this may be causing a whole lot of our social unrest thing too, because of some other issues with it. Okay, we're going to go to the next topic here. Thank you. So we're going to offer you the evidence-based medicine. Now, evidence-based medicine, a lot of us bandy that term around, and we're told about it, that we have to use it, but we actually don't even know what it is. Well, this is right off the ACA site, and they got it, a lot of it, from the British Medical Journal down here, okay? And so you're welcome to that. I think you should have that in your office when you're talking about it. What it amounts to as the best research-based evidence and what you're experiencing in your office is what it amounts to, okay? So basically that's what it is, and I think you should have a copy of that. Everybody should have it in your office, and you're free to ask for it. Again, click the button there asking for that, or you can email me for it, either one. We're making that available because I think everybody should have one of those. Now I have 4 TTAPS seminars that I give, and those seminars, I don't know why, but we're missing the box again. Sometimes it goes behind everything. We have 4 different videos, part 1, 2, 3, and 4. The first 3 are out. The 4th is being edited right now, should be out real soon. And since you didn't know about these, in post-production, they're $500 for a year's viewing, $250 pre-production, since you didn't know about them. If you order them today or the next couple of days, I'll still give them to you for $250. And you'll be amazed at what it is. Now, you get a view of it if you go online to ttapcenter.com, and it talks about them. We're going to go over those a little bit here. So you can get them, order them by calling me at 469-995-9907, or go to ttapcenter.com under Seminars Professional. Go to the seminar you want. Type in, under requested location, type in film and your phone number, and click the down arrow by $395 and choose $250. Now, what are they about? TTAPS Part 1 basically relates to reflexes only, plus some minor scar tissue in the skin that can have amazing immediate effects on conditions in the body. Okay? For example, we show you how to normally get someone off a cane or a walker in 1 or 2 visits, or standing up out of a wheelchair if it's not there because of paralysis. Immediately restore significant range of motion. Understand how reciprocal innervation can immediately help restore function in different parts of the body. Correct foot drop in the majority of cases, 1 or 2 visits. Cogwheel rigidity of arm and leg and stroke and cerebral palsy type of conditions. Improve hearing and tinnitus in most cases. In most cases, significantly reduces the following immediately. Usually on the same visit, fulfills the ACA evidence-based medicine best practices that we were talking about before. So fibromyalgia pain, sciatica, necessity of using a chain walker to walk, herniated bulging disc, unoperated rotator cuff or frozen shoulder, regional pain syndrome, formerly RSD, burning tongue syndrome, burning pain in lower extremities, genitals, upper body, female cyclical menstrual pain, vaginal prolapse, numb hands and feet, drop transverse cuboid arches, hyperhidrosis, polyhidrosis, cogwheel rigidity or stroke, ALS, Guillain-Barré symptoms, seizures, stop a seizure and keep them from coming back, cranial nerve symptoms. All these are verified by standard orthopedic and neurologic tests. Not just saying you can do it, you can verify it with those tests. Hearing loss of different frequencies, tinnitus, foot drop, all the outlet syndromes, cold or burning hands or feet, Raynaud's, loss of vibration sense in feet or toes, dizziness, vertigo, positive pinwheel test, bladder leakage, stop it, MS symptoms, Parkinson's symptoms, and a lot more. You will be amazed, guaranteed. This is not reflexology, AK, CRT, PNT, TMB, transverse friction massage, spinal reflex therapy, or contact reflex analysis, something totally different. It's based on known tenets of acupuncture, trigger point therapy, reflexes, and neurology. It's found in Laws and Tenets, in Dorland's Illustrated Medical Dictionary, Chusage Neurophysiology and Guidance Textbook of Medical Physiology, and others, as taught in all CCE accredited chiropractic colleges. Treatment effects are verifiable by standard orthopedic neurologic exam. I am published in JMP, Chiropractic Economics, and techniques being taught. I am a former adjunct faculty, postgraduate member of Texas Chiropractic College. Now, that took care of reflex only and mild scar tissue in the skin, or the dermis. Part 2 is on scar tissue and rehabilitation. The very first part is, in the first 4 hours, actually continuation of part 1 because we just didn't have enough time to do it. We teach you how very easily to muscle test over 200 muscles in the body in less than 10 minutes. Lightly touch one muscle like this and they all come strong immediately. You can immediately retest them. The only thing that doesn't come around necessarily immediately is if there's severe atrophy in a given muscle. That'll take longer. Second thing, now this keeps you from having to go from muscle to muscle as in applied kinesiology. You take care of it in all one fell swoop. Number 2, we teach you how to palpate the whole body and areas that are painful to pressure, i.e. myofascial pain syndromes. We teach you how to lightly touch one spot on the body on that patient. Immediately, no pain to pressure, the only exception being if there's a lot of inflammation. Immediately, that goes down by half, but it takes a little while to settle down. That's the only exception. This is called scar tissue and rehabilitation. Second thing we show you is how to rehabilitate a patient, normally about a fourth of the time that it would normally take. And then thirdly, we show you how to address dense scar tissue outside the joint. Now, if you take an ART, they tell you right in the seminar, Dr. Lay, it takes 4 to 6 visits to get scar tissue out of a patient. It's very painful, a lot of times leaves bruises. And Graston, you have to buy those expensive instruments. They say it takes 6 to 10 visits for a muscle. Transverse friction massage, right in Cyriac's manual, says 10 to 20 visits. And all those are very painful, take a long time, very exhausting for the doctor. I show you what to do. It's very easy. Just in seconds, to break up the scar tissue. Normally in one visit, a lot less pain to the patient, a lot quicker and easier on the doctors. You can get a lot more done. It really stimulates the referrals. Okay. What are some of the things that it helps? Chronic athletic injuries, which of course spill over to the regular population. Hamstrings, ankles, wrists, golfer's elbow, tennis elbow, rotator cuff, knee, turf toe, shin splints, chondromalacia patella, weak ankles, trick knees, etc. Plantar fasciitis, myalgia paresthetica, bronchitis and asthma, gagging, esophageal spasm, reflux esophagitis, TMJ syndrome, migraine, headaches, chronic whiplash, chronic hip, knee, and ankle, shoulder, elbow, wrist pain, tendonitis and bursitis, adhesive capsulitis, frozen shoulder, Dupuytren's contracture, trigger finger, Osgood-Schlatters disease, chronic fever, sore throat, old tissue and scar tissue and acupuncture, old fractures, chronic pain, bone sclerotome pain, fibromyalgia, burning pain, resistant sciatica, spondylolisthesis. I'd like to learn how to get rid of spondylolisthesis issues right away. We can do that. Necessity of using a cane or walker to walk from leg weakness, herniated or bulging disc, rotator cuff, frozen shoulder syndrome, foot drop, hearing loss differentiating frequencies, tunnel syndrome, small joint fibrous ankylosis, chronic shingles pain, arthritic finger and toe joints, unadhere organs from each other, stimulate circulation, lymphatic flow, diaphragmatic and accessory breathing, muscle function, endonasal. We show you 4 different ways to do endonasal. Female cyclical menstrual pain, stop it right on the table in a matter of seconds. Vaginal prolapse, uterine prolapse, bladder prolapse, anteroversion, retroversion, all of those. Dizziness and vertigo, drop longitudinal and transverse arches, so all the arch problems. Unexplained chest pain, MS, Parkinson's, AL syndrome, Guillain-Barré, ankylosing spondylitis symptoms, seizures, etc. Yarka, thank you for the comments. I appreciate that. And I'll look forward to your call. Thank you. And all these are not taken from anybody, but they're based on already known tenets. Okay? TTAP's part 3. So we've taken care of everything outside the joint. So part 3 is dense scar tissue inside the joint. So we show you very innovative ways to very easily adjust, manipulate, and mobilize to get exceptional results immediately. Okay? If you think you've seen it all, learn from a doctor. That's me, who's treated over 40,000 patients from 50 states, 97 countries, over 3,000 of which were upper level athletes, over 800 of which of those were professional, 12 professional athletic teams. I was the first chiropractor asked to treat NFL Run for Daylight and Fast Man competition athletes. I was invited there for that. Now here's athletes, but again, this affects your regular population. Ribs and costal cartilages, golfers and tennis elbow, chondromalacia patella, bunions, dementias, high arches, flat feet, drop transverse cuboid arches, reliably relieve reflux esophagitis, esophageal spasm, upper GI conditions, hiatal hernia. Did you see dementias here? Yeah, we'll show you how to relieve dementias from the knee very quickly. Acromion sternoclavicular chondritis, costochondritis, hallux rigidus, hammer and claw toes, bow legs, knock knees, frozen shoulder adhesive capsulitis, rotator cuff, the tunnel syndromes. Hiatal hernia, reflux esophagitis. Yes, we show you how to relieve those very quickly, and it's not from adjusting the stomach. We actually say this is an osseous adjustment. That's actually what's causing the stomach to drop and do all that. We show you how to regulate that. Cranial techniques. I've gotten autistic children speaking sentences after only single words, and they're squeaking, and then they start speaking words. Significant demeanor changes, even entering normal schools because they start talking more and more. They walk around angrily. Immediately they start losing that anger when you do it the way that I show you. And other docs I've reported treating autistic patients, now they can multitask when they couldn't prior to treatment. I had two doctors call me up, children One of them age 4, one age 5. Right after they did the 3-minute treatment that I showed them, they started talking immediately. One of them just turned to the doc and said, "Thank you, doctor." First 3 words they ever spoke. The other one said thanks or something like that. And the parents were there and they just started sobbing. The doctor was like startled. This is what happens when you do this autism treatment. I'm the only doctor on the recommended doctor list, chiropractor, in the state of Texas. Stop elusive migraines, improve vision, hearing and tinnitus, improve elusive organ and gland dysfunction, correct TMJ dysfunctions, and all the vertebral techniques. Really helps out. Now, those first 3 help improve the nervous system. The nervous system controls the secretory and excretory events of the body. So while you're doing those, a lot of people who did not respond to nutritional intervention just clear up by themselves. That's because it was a neurological issue that you just didn't realize it was, and you actually didn't know how to correct it. So when you're doing those first 3, you're going to get a lot of people that just biochemically clear up because it was a nervous system issue. So part 4 is strictly biochemical type of issues. And we approach this in a different manner because we show you, we start with, first it's got to go in the mouth. But we show you as we go through all the nutrients that virtually nobody has the lack of it going through the mouth. And we go over that with you, and every time the crowd agrees when we start going over these things, okay? And then I say, well, it must then be a problem with digestion, absorption, transport, penetrating through the cell wall, then going through the nuclear membrane or the mitochondrial membrane. Then does it break down all the way that it should, or does it stop and then it builds up and becomes inflammatory, okay? And then can you excrete it? And we go through all those processes, and we take you through all the metabolic pathways that occur, and we show you a negative feedback system without which we could not live in these bodies. And we show you, for example, just for an example, I like to use this, if you were lacking in electrolytes, what would you do? Normally, you give them electrolytes. Yeah, well, what causes electrolytes to form in the body? Well, it's the androgens. Okay? Well, yeah, okay, but what causes the androgens to form? Progesterone. A lot of people don't realize that. What caused the progesterone to form? Pregnenolone. What caused the pregnenolone to form? Well, it's vitamin D3, and it can be interrupted by a negative feedback loop from too much estrogens. Okay? So, also, progesterone causes cortisol to be formed, which a lack of cortisol can cause swelling and inflammation. Okay? So, what we show you here is you can correct like zero or low testosterone in a matter of a couple of weeks just by manipulating the diet with nothing else. Okay? Just by knowing these pathways. And you can correct electrolyte levels just by diet manipulation alone. And we're taught basically to interject where the symptom is. But what I talk about is you may have to go 3 steps before or 3 steps after where that symptom occurs in order to correct it, because that's where the actual problem is. So we take a way different route to show you different things. Okay? And we talk about every phase there. So I've treated, I've performed over 15,000 nutritional assessments. I've been a member of 6 nutritional, medical, and scientific boards of major nutrition company. I'm a master biologist. I have a master's in biology emphasizing human nutrition. How do you correct people who are allergic to basically everything? They can't eat anything and they get shots every weekend. Somebody who came in, they were getting shots for 28 and a half years every week. We got them off the shots. Okay? Autoimmune disorders that really aren't. Dysmenorrhea, excess prolonged flow, bone mineralization, osteopenia, osteoporosis. People are infected all the time. What do you do with those? Endogenous poison, metabolic intermediates, hormone imbalances, seizures, ulcers, bleeding ulcers, constant bloody noses, fungal and candida. You can get somebody over systemic candidiasis in 2 or 3 weeks. Yeah, it's totally possible. We show you how to do it. Chronic fatigue syndrome, psychometabolic and viscerosomatic syndromes, et cetera here. We have, we talk about bioavailability and all these different things here. Okay, abnormal cell growth, behavioral disorders, all sorts of hormone things, depression, et cetera. So I would urge you, if you don't have these, to order them. I would also urge you to take the seminars, okay? Because you'll learn a lot doing both of those. And of course, with the film, you can go over and over it again. And that particular one, part 4, will be out. So I would urge you to order any of those if you don't have them already. Now, the next topic is that I do mentoring, and we call it Preeminence Mentoring. As I discussed, I've seen people from all 50 states and 97 countries. For several years, I averaged 640 new patient calls every month. And when 911 happened, when most practices dropped by 30 to 50%, some up 70%, mine went up 1,700%. Okay? And you can do that. Yeah, Dr. Danforth says, take the courses to get hands-on. We recommend that, and then you can repeat it over and over to get it down. Just remembering stuff is repetition. Mentoring testimonials. Preeminence mentoring is what I've been searching for. This is Dr. Larson. He's up in Minnesota. He basically had taken several before, but I'm the only one who allowed him to take his practice where he wanted to go. Everybody else wanted to take his practice where they wanted him to go. And he's been on for more than a year now and has gotten very good growth. Dr. DeSaulniers in California. Dr. B's mentoring program is second to none. Wealth of knowledge made me much more thorough and streamlined doctor. Dr. Bonebrake's mentorship program is the best investment I've ever made. Thought the first time I spoke with him, classes were different from what I already knew. This doctor is Squardo in Cleveland. Dr. Cianski was up in Chicago. Built him up for over a year, and he decided, I want to go down to Florida. I built my practice up. I'm going to go down there, and we're going to develop one there. So he's down there. He's in his second year. Dr. Mitchell, he's down in Houston. I wasn't sure if I needed a mentor. I already thought my business was very successful. He attended a seminar, realized he needed a lot to learn. And he's been there very satisfied. He's in his second year. I can't believe how much my practice has changed and grown since I began mentoring with Dr. Bonebrake. This Dr. Taylor, he's in Fort Worth. Dr. Meyer is in Austin. Been in practice for 23 years. Own and operate a successful sports medicine clinic, which Dr. Taylor does too, by the way. And he says, I don't do no fluff, no cookie cutter, no one size approach fits all. I want to get you where you want to go, and that's how we tailor it for you. Dr. Danforth, who's on the call right now, here's his testimonial. He's up in Lubbock. He's in his second year. Got a lot of good results. Dr. Johnson, he is down in the Houston area, I think Katy, Texas. I've been a sole practice 25 years. Been to a lot of seminars. He is just very satisfied with what he's getting with me, okay? And I have a lot more, but those are all that I posted right for the moment. Now we're going to talk about the Preeminence Mentoring itself. Okay, Preeminence Mentoring is a good fit for everybody. And that's because I'm not trying to make you into my practice. I want you to have the practice you've always dreamed of. And others don't really do that. They're trying to fit you into the mold that they want you to be in. Okay? The program enables you to be top level. Excuse me, I'll put that red dot in there again. Rapid, efficient patient response with scientific methodology found in medical literature. Become a nerve and biochemistry expert. My object with you treatment-wise is to get you every visit the patient is in to get quick, jaw-dropping response. That's the big thing that's going to get you patient referrals. There's also a way to talk with people. And I myself have taken 32 different practice management, consulting, and coaching firms, and I developed mine out of those, and mine's totally different than those, okay? But I like to get quick and to the chase every time I talk and interact with a patient. I like to get them on board with what they want and my method of practice. And the way they do that is if you're straight with them and you're concise and you get jaw-dropping response every time. Get referrals from everywhere. Folks, I've gotten referrals from all 50 states, 97 countries. There is no reason at all why you can't also. I am nothing special. You hear me stuttering, fumbling around here. I'm totally monotone. I am not a David singer. You don't have to have, that type of charisma. I certainly don't, okay? Get paid what you're worth, low stress and family time, others committed. I want you to just close your eyes and imagine the business of your dreams, smooth running, plenty of highly satisfied and enthusiastic patients, as many as you want or can handle. Financial security, time to enjoy with your family, time to exercise regularly, great health. 3 reasons Preeminence Mentoring works for you. You'll devote the effort, time, and dedication to get what you want. You have to do it. I can only tell you what works, okay? Charisma is obviously not necessary. Group or one-on-one mentoring is very affordable. Your next step is commit to be superlative. Go to the link, ttapcenter.com, choose a mentoring level that fits you, commit to change your life. Now, the mentoring includes 12-month group mentoring. And I apologize, I changed that to $500 per month, but since you're on here, you can still have it $250 a month. That's one group call each week for 12 months for an hour each, or one payment of $2,500, which I've upped that to twice what it is, but you can still have it for that since I forgot to change it here. Basically, you're listening to the questions that other doctors ask and how I answer them to get their questions asked. Plus, you can ask whatever questions that you have. All of you get to interact on there, okay? And you learn from each other from the answers I've given. They may ask questions you didn't think to ask, and vice versa. You may ask ones that they don't. So you can cover anything that's going on in your practice. People that work for you, how to hire, how to fire, how to write contracts for associates, how to treat different conditions. Most of the time, doctors ask me, well, I got this patient with this, how do I do it? And I say, okay, you get all the notes from each of the parts. Go to part 1, this note, and this is how you treat that. Part 2, part 3, part 4, whatever it is, and I guide you through it. I want you to get to where a patient comes in, they have a given condition, you hear it, you look what they're experiencing, you ask them 2 or 3 questions, bang, you know to go right to it. And you do what you need to do in a matter of seconds or just a few minutes. And you're done, they got the results, and that's it. You don't have to take 15 minutes to half hour on a treatment. You get better results taking 30 seconds to 2 minutes, okay? Now, how did I get that way? Well, folks, you haven't lived until you've taken care of a football team, and you had to treat all 73 players within an hour before the game, then again at halftime, then again right after the game, okay? So in a span of about, roughly 5.5 hours, you've treated 222 visits, and you rested for 3 of those hours, okay? You have to get results. You got to get them quickly to be in that position, and you learn how to do it that quick in your office, okay? That's what forced me to do this. I like to put myself into a position where it forces me to learn something. Just like giving these Thursday night talks. I force myself to go and educate myself more to get the information to you also. Okay? We show you how to testify in court, how to write killer narrative reports so you get much better settlements. Okay? Now, if you up to the one year one-on-one mentorship in the first 3 months, you get those benefits as well. Next level is 6-month one-on-one mentoring. It's $1,000 a month or one payment of $4,000. Saves a third or $2,000. Well worth it. You get all those other things we just talked about, only it's just you and me one-on-one talking about your practice and your practice only. Okay? If you decide to go up to the one-year membership in the first 3 months, 1 year one-on-one, then you get all those benefits. The 1 year one-on-one is a call a week for 52 weeks. 6 month is a call a week, an hour for 26 weeks. Okay? Now it's $1,000 a month or one payment of $8,000 saves you $4,000. That's a third. It also includes a year of all 4 of those films from the time that they come out. Plus, I'm going to be making, when I'm done with the films, I'm going to put up a link for each part for websites. Okay? So basically, when you have your website there, I have thousands of testimonials of patients and doctors who've taken my seminars that worked on patients. Okay? And so there's going to be a bunch of testimonials alphabetized so that a patient can go right to their condition, click on it, and here's doctors and patients telling the results they got with part 1, part 2, part 3, part 4. Okay? Now what that does is it's now not just you saying, well, I took this wonderful TTAP seminar and here's the results we can get, and they go, oh, yeah. Here they're actually seeing people who got the results and doctors who treated patients who got the results. Much powerful punch. Now I put those up on my own website years ago, and it was good for 20 new patients per category. Plus, I told my existing patients to go on and look at them. And a lot of them said, hey, I didn't know you could take care of that. I need to come in again for those. So every month I got 40 essentially new patients per category, or 160 new patients a month. This will help you get new patients like that. Now you don't have to be taking part 4 for that. You get it free with that membership on that. You can do that for $50 a month per part when it comes out. So that'll be come out. You can have it for that also without having to be the mentoring, but you get it free with the mentoring. We're going to have a doctor's blog. And that's going to be $50 a month or free with mentoring per part. So you get to jump on there and you say, well, I have a patient with this problem. I can't figure it out. What would you do? So the doctor's going to interact. Now, neat thing about this, not only do you get the TTAPs part, but other docs will tell you things that they've done outside of TTAPs to get the results. If you all get hung up, what would you do, Dr. Bonebrick? And I pitch in and I say, okay, this is what I would do. So everybody's learning from everybody on this. And you throw in, hey, I did this on this patient, I got these results, and other doctors just seeing what you did get the idea from it. So you can ask questions or just give answers when you got a great result. So that's going to be real good. And that'll be up for a year again when you have that membership. And so you get a year one-on-one with me for an hour each week. So 52 of those. Plus all those other things. Basically, why wait? Get your dream practice now. I am not one to wait. When I see something that I know I need to do, I just jump in and do it. When I started doing these Thursday podcasts, I said, I need to do podcasts. So I just jumped in and I started doing it. Just the same as that. So basically, lose your excuses and take consistent action to improve. If you do this, sign up. Don't wait. If not, don't sign up. You're going to be wasting your time and your money. You're the one that has to take the action. I'll give you the information and encouragement, but you have to take the action to improve your life. It's all up to you. But I can guide you there because I've done it, okay? And most of these people doing the practice coaching and mentoring and that sort of thing, they haven't done it themselves, okay? So, I don't know how that got off of that, but I apologize you didn't even see that. It looks like most of you, and I apologize for that. So, now basically, what happened here? Did I lose it? Okay, so you can still hear me. So basically, while we're still on the hearing there, I guess you can see me over here in the box here. Just if you have any questions right now, just go ahead and ask. And let's see, where are the controls here? I don't even know what happened to the controls. Okay, if you have any questions, you can ask right now. Just ask anything that you want to right now before we take off. I went over about 10 minutes and I apologize for that. So if you have any questions whatsoever, go ahead and ask them. Any questions whatsoever? Any questions at all? Okay, I thank you very much, and we'll see you in about a week. Thank you so much for your comments, and you all have a very good week. And I'm sorry I didn't have that last one up. I didn't even realize that it wasn't up so you could see it. Okay, we'll talk with you in about a week with a different topic. Thanks so much. Wow, I don't know how that happened. Okay then. Oh, there it is. Okay. Didn't realize I messed that up. Alrighty. So, we will talk to you later.